Well, good afternoon, everyone, and welcome to our COVID-19 daily briefing for Tuesday, November 10th. We will not be holding a COVID-19 briefing tomorrow due to Veterans Day, but we'll be back here on Thursday. And I want to encourage everyone to take some time tomorrow to honor our veterans. And if you're able, to find an organization near you that serves veterans and offer to volunteer in some fashion or to make a contribution. Our veterans deserve our respect and our dignity and deserve to live with dignity, and we should all do what we can to recognize their sacrifices on our behalf. I know many of us hoped not to still be fighting this deadly pandemic 9 months after it revealed itself. Way back in March and April, many Americans and those abroad had visions in their heads of somewhat a normal summer, or after that, a normal fall, and then eventually maybe a not so bad winter. We're all looking, hopefully, toward a better tomorrow, even as the public health experts warn of new waves of the virus as more people spend time inside in the months to come. We all want this to be over, but we need to gird ourselves for winter because it's not over yet. Neither has winter come, nor is the pandemic over. We have potentially months of the fight ahead of us. As hard as that sounds, yesterday we were given some real hope. A preliminary analysis of a new mRNA vaccine suggested 90% effectiveness in preventing COVID-19. That's potentially a very big deal. It proves not only that an effective vaccine might be on the horizon, but also that the multiple vaccines that use this new spike protein technology attacking the part of the virus that helps it latch on to human cells are on the right track. There are more trials ahead to determine if there are safety concerns, if the vaccine offers protection to those with prior COVID-19 exposure, if it protects against severe COVID-19, and if its effects on human immunity lasts an appropriate amount of time. But the news yesterday was potentially a very good sign of things to come. And as I've said in weeks past, we stand ready in Illinois to build the appropriate logistics chain to distribute vaccines to our state's residents. In the meantime, we're locked in a struggle with this virus as winter approaches. Today, I want to focus on COVID-19 hospitalizations. Across the state, the majority of our regions are seeing far higher rates of hospitalizations for COVID-19 than they ever did last spring. Outside of Cook and the Collar counties, much of Illinois' communities are experiencing the worst surge that they've seen yet. Region 1, northwestern Illinois, has nearly doubled where it was at its COVID-19 peak of hospitalizations in late May. In southern Illinois, Region 5 has more than doubled its hospitalization peak from the spring in late April. In central Illinois, Regions 2 and 3 have seen a 2.5 and a 3.2 times increase in hospitalizations, respectively, from their spring peaks in early April. And Region 6, East Central Illinois, has now surpassed 3.5 times its spring hospitalization rate. Even where things are not as awful, things are still bad. Region 4, the Metro East, and Region 7, Will and Kankakee counties, are running just above the worst that they saw in the spring, with no sign of slowing. Regions 8 and 9, the Collar counties, are close behind. Though still below their spring highs, things are close and they're increasing. Only Regions 10 and 11, suburban Cook and Chicago, remain a fair distance behind their worst hospitalization peaks in the spring by about half, but we're seeing concerning trends in suburban Cook County. Statewide, we're now averaging more than 4,200 patients with COVID-19 in the hospital. Our highest average in the spring was 4,822. 4,200 now, 4,800 back then. In short, we're now just hundreds short of our worst COVID hospitalization numbers last spring, after adding more than 2,000 to that number and that average since just October the 1st. I have been in touch with hospital leaders and with healthcare workers across the state. It's a difficult time for them. They're doing amazing work, but we must not let them become overrun. We're listening closely to them, and we'll do everything to protect them. They have a message for everyone listening. They implore you to make sure that everyone wears a mask and stops gathering with a large number of people in your homes. They need your help. We're not alone in this fight. The nation is in a precarious place right now in this pandemic, and just as other states here in the Midwest and across the nation are imposing stricter measures to keep people safe, we are too. As I said last week and yesterday, we're monitoring the numbers closely, and additional statewide action is possible. We're also continuing to make sure that testing is as accessible as possible in Illinois. And indeed, we remain one of the top testing states in the nation and the best testing state in the Midwest. To that end, I'm pleased to announce that we've surpassed a new milestone in Illinois. We've recorded more than 100,000 tests in the last 24 hours, our first day of testing in the 6 digits, making us one of the first states to do so and the first in the Midwest. We know there's a renewed demand for testing statewide as positivity rates rise, so we're making every effort to keep building out our testing infrastructure, and this is a critical milestone in that endeavor. But it's critical to remember that nothing makes a bigger difference in this pandemic than when a community decides to protect your own, by wearing masks, by avoiding gatherings, by temporarily closing high-risk, high-exposure businesses until we get to a place where it's safer to open again. I know it feels like we've been at this a long time. The whole country, the whole world has. 9 months is a long time. But we can't let our guard down. Look at these numbers. More than 10,000 of our fellow Illinoisans are getting infected each day, and dozens are dying each day. There is light at the end of the pandemic tunnel, but we just don't know exactly when we will get there. So let's use the best tools that we have in the meantime: local enforcement, masks, distance. Stop having social gatherings for a while, and get your flu shot. Let's make a renewed effort to keep each other safe as we enter this holiday season. And with that, I'd like to turn it over to the Director of the Department of Public Health, Dr. Ngozi Ezike.
Good afternoon. Again, today reported an all-time high of newly identified COVID cases to the tune of 12,623. This brings our total number of cases in Illinois to 511,183. There were 79 new deaths reported for a total of 10,289 total lives lost to this deadly virus. Overnight, there were 4,742 people in the hospital with COVID-19. Of those, 911 were in the ICU and 399 were on ventilators. In the past 24 hours, again, as the governor mentioned, we had our first day over 100,000 tests being reported for a 24-hour period, which brings us to 8.5 million tests since the beginning of this pandemic. This week, our COVID-19 mobile testing sites are set up in cities and towns across Illinois, from the Highwood Public Library to the Hiawatha High School in Kirkland, to the Decatur Civic Center, to the Aquatic Zoo in Mount Vernon. These and many other places are offering free COVID-19 tests no appointment necessary. Please visit our testing webpage for hours and locations, www.dph.illinois.gov/testing. Early on in this pandemic, there were actually requirements to get tested at our testing sites for this novel virus. That was because supplies and testing capacity was limited. But now, fast forward to today, anyone who wants a test can show up at one of our drive-through sites. I heard that at our Aurora site, even before we opened, there were 400 people in line to get tested. I really want to commend you, Governor, because you really had your foot on the gas pedal all along, and were really pushing us to get to this day. You did often talk about, what about getting to 100,000 a day? Well, we are here now. And I want to thank all of the people on the testing team who have made this milestone possible. Today, the only requirement to get tested at one of our testing sites is to be a responsible Illinoisan that wants to know their status and wants to know whether they have COVID or not so that they can protect those around them as quickly as possible. Please set the example for your family, for your friends, for your coworkers, for your community. If you've never gotten a COVID test, unless you've been literally indoors in your home for the entire 9 months, it's good to get one. Again, we have to just remind you of the same things we've been saying all along: mask up, wash up, back up, and sleeve up, referring to roll your sleeve up to get your flu shot. Regardless of what you may have seen on Twitterverse or at Facebook or Parler, we need to follow the science. These measures will work to get us on the other side of this pandemic. Please help us prevent the spread of COVID-19 and the spread of the flu. And let me add my salute to all the veterans who have done so much for us in this country.